travels, we're already there. We've opened 20 additional areas in our ED lobby at our main campus to see patients that need our care that are not COVID related, that may have a heart attack that's going on, or a stroke, or just need somebody to evaluate their need in the moment. Our nurses, it's tough. I walked around the hospital yesterday and talked to a lot of them. It's hard to do with a dry eye. And they're broken when you're talking to them. This is not why we got into medicine, to take care of things that are within our control. We got into medicine to take care of all those that need us, and that is what the staff is doing currently. But they also know that this could be controlled better if you were to get vaccinated. We have done everything we can to provide monoclonal antibody infusions. We are doing that almost for the entire Mid-Ohio Valley right now. We opened 4 clinic slots a week. We're up to 5 as of yesterday, doing between 15 and 20 infusions a day to do everything we can to help these patients. This has been a really rough week, and I think this will be big for everyone. We have had 18 COVID positive related deaths this week in our hospital. And what's different this time than it was in December is, quite frankly, they're young. They are younger people. They're 33, they're 37. Every morning I'm woken up by one of our overnight hospitalists to ask permission to have somebody be at the bedside with a younger patient, it seems like anymore, that's dying. They need somebody there to be with them. 56 this morning, 52 yesterday morning, and of course all ages in between. It's tough to swallow right now, and I can't reemphasize what the governor has said and Dr. Vanderhoff already. You need to get your vaccine. I want to share a small story, if I may, and I'm sorry if I'm taking too much time, sir, but I feel it should be important for people. You know, I know that people have to make a personal choice. And I was reminded about this with a couple people I know, a mother and a son. And I won't tell you their names, obviously, but the son was in his 40s, is in his 40s, and the mother is older than that, obviously, and they did not get vaccinated. That person was admitted to the hospital and continued to do poorly, but it was very important to him to reach out to his mother and say, we were wrong. Get your vaccine today. I offered to personally drive it to their house because it does matter. Every single person that gets vaccinated, it matters. So I think I've said my story enough. This is definitely the worst we've seen, but we are standing ready in the Mid-Ohio Valley to take care of every patient that comes to us, but it's stretching us thin. So please, we ask you all to do your part. If you're not vaccinated, get vaccinated. Reach out to somebody. I know myself, and I know Dr. Patey very well, would be happy to have a conversation with anyone in regards to why you should get vaccinated. Thank you for the time.
Doctor, thank you very much. Yes, sir. That was pretty gripping. Thank you very much. Dr. Patey, set you up.
So I'm on the health department board, also run an urgent care center in Marietta. I'd like to reiterate a lot of the same concepts that Dr. Brees voiced. We've seen a 400% increase in our urgent care volume in the last month. Almost 100% of that increase is either COVID testing or COVID illness. 90% of those COVID patients are unvaccinated. So most all patients that come in with symptoms are unvaccinated. Our patients at QCA is our family, and unfortunately several of them, within days of being well in the clinic or not appearing critically ill, die within 2 or 3 days. There can be sudden turns. Our staff is stretched thin. We've tried to hire additional staff. We have everybody there every day. We're doing the best we can, but fatigue is an issue. But we're there doing what we can, and we request the public to do what they can. And this is clearly a medical issue. Clearly vaccinations help. It's not a political issue in my eyes. While vaccination may not help you today for this current surge, it will help our community and our country the next several months down the road. We have to get a grip on this. We have to stop having large group gatherings without mask and distancing. You know, the simple basics, the stuff we've known for almost a year and a half, 2 years now, we need to get back to. Wearing masks, wearing the correct mask, distancing. We've had 2 large group events in Marietta in the last 2 weeks. We're seeing the surges from that. Dr. Brees is mentioning the inpatient surge. It's clearly related to large group gatherings. Washing hands, distancing, getting vaccinated, mask in school. You know, I think those are some basic things that we can do to get a grip on this. I just wanted to reiterate that. We're going to hang in there, do the best we can. We're referring a lot of patients to Dr. Brees and Marietta Memorial for the antibody therapy, taking care of people, trying to keep them out of the hospital the best we can. So I applaud the local hospitals. I applaud my staff for their unending, untiring efforts. But we need to turn things around. Thank you.
Doctor, thank you very much. Let me ask Leanne Johnson to come up, the wife of the congressman. The congressman is working hard today, but not here. So, Leanne, thank you.
I'm currently a student at Ohio University studying public health. And the #1 goal of public health is prevention. It's keeping the community healthy. And the way we prevent this now is with vaccinations. I feel very strongly about that. I feel also that that's a conversation between you and your doctor, like Dr. Patey, like Dr. Brees. Have that conversation. Be informed. But I think it's imperative that our communities stay healthy and safe by being vaccinated. Thanks, Governor.
Thank you. Thank you very much. Let me ask Marietta Mayor Josh Schlicker to come up and just kind of give his view of what he's seeing in Marietta. Thanks, Mayor.
Well, thank you, Governor. It's great to be here. Thank you for coming to Washington County and the area. Yeah, we've seen the cases in Washington County, Marietta, increase. I serve as the president of Marietta Belpre Health Board. We had a meeting today and received the updated numbers and figures for the last month, and so we go by what we are reported and by what we are getting from Marietta Memorial and the whole entire health district. So we're doing what we can locally. We're probably going to look at more restrictions on our own employees and our own buildings, public buildings. That'll be coming out soon if the numbers continue to rise or stay at the same level. And but we appreciate all what Marietta Memorial Health System, Governor's Office, everyone, Department of Health, Ohio Department of Health, what everyone contributes to this, and we will continue to do what we can to do as a city to prevent the spread and try to reduce the numbers. Thank you. Thank you, Governor.
Mayor, thank you very much. Now, Marietta Belpre Health Department Public Information Officer, Rebecca Aber. Rebecca? Somewhere. There you go. I'm sorry, you're back there. Excuse me.
Hi, my name is Rebecca Aber, and as Governor DeWine said, I'm the Public Information Officer for Marietta Belpre Health Department. We were just comparing some of our stuff in our board meeting this morning, and as Dr. Brees said, you know, it's a choice to get the vaccine or not, but we just remember that if it is your choice to not get the vaccine, those that are around you and your loved ones and your family members, your community workers, your co-workers, all of those are affected by the results of you not being vaccinated, whether you choose to or not. So it is a community effort that we all need to come together to get the vaccination and do those precautionary procedures. Thank you.
Thank you very much. Public Health Emergency Preparedness Coordinator Brian Young. Brian?
Thank you, Governor. I don't have much to say that hasn't already been said other than just an appeal to the people out there. Please get vaccinated. This is the easiest thing that you can do to bring an end to this pandemic, and we all want to be able to get back to normal and not have to worry about leaving our houses without masks on all the time. Between the 2 health departments and the pharmacies in the area, you can walk in and get a vaccine any day of the week. and most times of the day too. So please, we are doing our best to keep everyone safe. We are keeping PPE in stock, and if you need anything, you can let us know, and we'll be there to help you. That's all I got to say.
We're happy to take questions. Anything? I got the health experts behind me, so you don't have to ask me a question.
Okay. I wondered, there are so many people that just refuse to get vaccinated. Is there any way to encourage them? Or is it just one of those things that people are just completely unwilling?
Well, I'll start off, then I'll let the professionals talk about it. There is good news. We're seeing vaccinated in Ohio new people every day. And we're averaging about 10,000 new people across the state every day who for months have had the opportunity to get vaccinated but have not become vaccinated for whatever reason. They're changing their mind. I think many times it is knowing someone who got sick. I think many times it might be knowing someone who actually died from it. So I think as more and more people get it, the reality sinks in to more and more of their friends, more and more of their neighbors. So that would be my only comment. Who else? Anybody else want to talk about how we can enhance vaccinations?
Yes, Governor, I think what I can add to that is that no vaccine in human history has been better studied than these vaccines that we currently have. When you balance that, you balance the fact that these are highly effective, very safe vaccines against what you're hearing today, that this is an illness that lands too many unprotected, unvaccinated Ohioans in the hospital, in the ICU, and sadly causes some of them to die. I think the choice really becomes fairly easy. Vaccination is our safest and best path to a healthy future, and there no longer really is much reason to be fearful of the vaccine. Look at what the virus is doing. Look at the benefits of the vaccine. I think the choice is pretty clear.
I think the most compelling statistic, and it varies by parts of the state, but I think the most compelling statistic is this. Of the people who have been in Ohio hospitals with COVID since January 1st, 98% of them were not vaccinated. So that, I think it just tells you how powerful this vaccine is, and that the people who are getting it today, by and large, particularly the people who are getting it and end up in a hospital, are people who tragically have not been vaccinated. The numbers are just staggering, and certainly, I would think, convincing. Anything else?
Gave some numbers for the Region 8, the hospitalizations, the cases, ICU, and so forth. Are you finding that this is becoming a more serious problem in Region 8 or southeastern Ohio than it is in the rest of the state?
I'm going to let Dr. Vanderhoff answer that. I will tell you that just looking at the number of cases every day, that there is no county in the state that is not a high-level spread today. Early on in this, there were counties where you looked at them and said, well, your odds are pretty good. You're not going to get it. I don't care how big the county is, how small, rural, city, suburban, it's there. It's everywhere. Dr. Vanderhoff?
Governor, I think you said it very, very well. What I would add to it is this. During earlier phases of this pandemic, many parts of Ohio, especially rural Ohio, were largely spared from some of what the more urban parts of the state were seeing. That's not true anymore. The Delta variant is so contagious, it is so deadly, that it is seeking anyone, anywhere, who does not have immunity. That's why we're seeing the numbers we're seeing in our hospitals everywhere, including in Region 8. That's why we are seeing our hospitals filled with people who are unvaccinated. So there could be no more clear, no more stark proof that everyone's best bet is to go out and get a vaccine.
Anything else?
The rumor that Washington County was second in COVID cases. Is that what you guys have found?
No, look, that is not true. I'll pull up here in a minute and tell you exactly where Washington County is.
Okay.
But that is not true.
Okay.
Washington County's doing okay, but nobody's doing very well. You know, I mean, everybody's doing bad as far as the number of cases. And you know, I always look at it as just from the perspective of what are your odds of getting it. And your odds of getting COVID, if you have not been vaccinated, are in Ohio today extremely high. It is going to be very difficult without being vaccinated to avoid it. Your best bet is to wear a mask when you're inside and you're close in with people. I mean, that's the best thing. The better quality mask, the better. But there is nothing that compares to the vaccine. I mean, if you ask 10 things we should be doing to get rid of this, first 9 are vaccines. I mean, it's vaccine, vaccine, vaccine. I mean, there's nothing even close to it. So it is getting vaccinated is the ticket out of this COVID. Getting vaccinated is almost a guaranteed way to avoid going to the hospital. Getting vaccinated is almost a guaranteed way to avoid dying from COVID. The numbers are phenomenal. And as Dr. Vanderhoff said, this has been just such a much more a potent and effective vaccine than I think anybody ever thought. Eve, could you pull up on that slide? Did you find Bruce has got it. If I can read fine print in the sun, that's the question. All right, hold on. All right, so Washington County, just to put this in perspective, 100 cases per 100,000 population for a 2-week period of time is considered high incidence by the CDC. Washington County is now at 1,266 on that slide. That means that in the last 14 days, there have been reported, attributable to those days, 759 new cases. 759 new cases in Washington County over the last 14 days. So as I said, everybody is pretty high. No. And so, you know, Washington County is higher actually than I thought it was. So Washington County, according to this, is number 12 out of 88 counties. Number 1 being the highest. Pike County is now the highest. Perry, Lawrence, Muskingum, Scioto, Monroe, Brown, Morgan, Richland, Adams, Highland, Washington, 12. Okay? Anything else?
I know, and then I don't mind being corrected on this, but if I understand, you've been against the president's federal requirement, mandate, order, whatever you want to call it, regarding vaccines, and I guess that could also extend the masks in some cases. But do you think it's more appropriate for states such as Ohio or West Virginia to issue such requirements?
Let me explain this. I think that what the president did was a mistake, is what I said. And the reason I think that is because I think it stirs up this political debate, and it's going to be an extended period of time before, you know, that even goes into effect. I'm talking about a mandate on business to require all their employees to be vaccinated. We're at a critical time now. And the most effective way to get people vaccinated today is to convince them that it's the right thing to do. We have seen people pull back, get mad, however you want to describe it, over the politics of it. No one should tell me what to do. Okay. I think we're better off in saying, look, the state of Ohio is not going to tell you what to do, but we're going to give you the facts every single day. I also believe that the bills that are in the state legislature that would tell Ohio's hospitals they cannot require their employees to be vaccinated if they want to, I'm against those as well. I think that is a serious mistake. We should allow the hospitals to make their own decision about what it takes to keep their employees safe and what it takes to keep their patients safe. So, again, I think it's that decision, however well intended by the president, I think has got us off on another road here, and I think we need to get back on the main road. And the main road is to really get more and more of our fellow Ohioans every day who will come forward and say, yeah, I've seen it, I've seen enough, I lost a friend, I lost a relative, I want to get vaccinated. And as I said, we're vaccinating about 10,000 a day. We need new people. We need a lot more than that. And so that's why we're out here. And I think to some extent we're starting to get used to death. We don't want to get used to death. We don't want to get used to death from COVID, because today those deaths are almost all avoidable. We're all used to deaths that we can't do anything about. Every family has tragedy. Everyone sees people die during their lives. But when you see people die, and I see people as governor of the state of Ohio who are dying every day who did not have to die, it breaks my heart. And we've got to change things. We have to start getting more people vaccinated. And these deaths are a waste. They're a human waste. When the doctor was talking about 30-year-olds and 40-year-olds dying, people who had a whole lifetime ahead of them, people who probably had children, people who would like to have had grandchildren, this is just a horrible, horrible waste. And it's so unnecessary. It is so preventable. Okay, thanks everybody.